If y'all need to take a restroom break, just ease out and do it, because I'm just going to continue on. This guy's looks like he's had some burns. Thank you, Captain Obvious. Yeah, we'll talk more about that. What does the skin do? It protects, right? What happens when you lose that protection? You're not protected. Thank you, Captain Obvious. Right. Your main two issues with burns is going to be shock and what? Infection. Hypothermia and all that does fall into there, right? With your burns, you know that there's several different kinds of burns that go different depths, right? Nonetheless, it doesn't matter if it's just a second degree burn or a superficial burn. If it covers up enough body surface area, it can still do damage to the body. Your different types of burns, your thermal, chemical, and electrical burns, each are going to have a particular type of management. Then you get into inhalation injuries along with burns. Why is carbon monoxide a concern when it comes to burns? Right. On just a non-Sunday school answer is the fact that carbon monoxide is a byproduct of things that are burning. What burns you? Things that are burning. So if you're breathing those things that are burning, you're going to breathe in the byproduct of the things that are burning, right? Also, cyanide. You need to know your burn center guidelines because I'm going to tell you right now, if I get burned up over 80% of my body, don't send me to East Alabama. Take out the middleman. Take out the middleman. Safety is very important with burns because, hey, you're not a paragod. You could get burned, right? Your skin is your largest organ. If it gets burned up, then you have issues. If you lose your skin, you lose your mechanical barrier, you lose your protective barrier, your senses, and you lose temperature regulation, right? Hey, your skin can get injured pretty easy. I mean, all you got to do is go out in the sun for a little while and not use sunscreen, and you can potentially get a pretty bad sunburn, right? I mean, in some cases, even second-degree burn. The skin is very sensitive, so all it takes is a little bit of something and it's going to burn. I mean, people get burned by lotion, so it'd be a chemical burn, of course, but your degrees of burns, you got your superficial, which is usually like your sunburn. Your partial thickness is going to be your second degree burn. That's going to include superficial burns, but then you're also going to get a little bit deeper in past the epidermis, and you're going to see a lot of blistering as well. Then your full thickness goes what?
All the way down.
All the way down. Some of the tools that we use out in the field would be the rule of nines, the Palmer surface, and this London Browder. Had y'all ever heard of Mr. London Browder? Had you?
Been burned after.
Yeah, because I'm going to just throw this out here. I had to look up what that was.
What is it?
I don't know what it is. I've heard of it.
Basically what it is, the London Browder chart uses the Palmer method for like kids to where the rule of nines, it may be in a smaller area that's burned. And the London Browder has a chart on it that kind of gives you an idea of if they're within this age, just by what a normal kid's hand size was. If the lower extremity was burned, it would probably be 2.5% of the body. Whereas if you took the rule of nines, you're going to have to, figure out a little bit better. Major tissue damage on your superficial is just your outer epidermal layer. That's where you're going to start peeling. Have y'all ever had a bad sunburn where you're peeling and sat next to somebody that's one of those freaks that likes to peel skin off. That is just nasty. Nasty. And I don't know what that has to do with anything, but I just had to throw that in.
Hygienic? It sounds like you had a bad experience.
I know. I get some big freaking out when that happens.
Feet and
Kind of
skin.
feeling.
If you've ever had a bad sunburn, you know that it hurts, especially those first couple of days. Treatment, I mean, what? Sure. I'm just going to continue on. If you get called out for a sunburn, it may happen. How are you going to treat it?
Tell them to put aloe on it.
Yeah. You're going to maybe pour a little cool water on it and pet them for a minute and then move on. Partial thickness. It includes your entire epidermis, then it gets down into the dermis. There's usually no scar, and that's false because I've got I had second-degree burns on my hand, and I've got scars from it. The biggest thing you're going to see there is that you're going to see these pretty bad blisters, all right? You do blister with sunburns, but that's usually because that burn has gotten so bad that it's gotten into a layer of the dermis as well. Your management for these is going to be to cool and cover with a clean, dry, and they didn't include in here, but a dry what? Sterile dressing. And then oftentimes you'll use antibiotic creams, and the most common cream that you use will be Silvadene. Then your full thickness, this picture's been in every textbook I've ever seen.
No.
I was trying for us to move on without noticing the sex organs that are just exposed.
I want to know what he did to hit the inner third-degree burn.
I don't know, but he got some pretty bad burns. And if you notice this leather-like E-scar, that could happen. What's the problem with this? What's the problem with this when the skin gets like that? All right, infection is a problem, but as far as the skin itself, the surrounding skin, it loses all of its elasticity, right? So that becomes a problem if you get into areas like your lungs or your chest, all right? And even if you've got full circumferential burns around arms and stuff, what's going to happen? If that skin can't expand out when the inflammation process starts, yeah, you're going to get compartment syndrome, right? They need a burn center. I don't like to read charts because you guys kind of know what goes along with these. You can look at that. Some pretty bad burns here. That poor baby right there has gotten burned up.
It's probably, it looks like a pot of boiling water. Like the side of her face all the way down.
Yeah, that looks like gunpowder residue or something. I could be wrong. These are exceptionally sad right here. These are stocking burns. You know what that's called from? Yeah, treating that kid like it's a little lobster and dipping it down in some boiling water. That is ridiculous. I would kill somebody. When somebody gets burned, you got to remember that that burning process is still going on, even though you don't see flame or smoke. That's one of the main reasons why you need to try to get that area cool, right? Again, trying to get this done, not trying to tell a whole lot of war stories, but a while back when I worked at ETS, there was a guy that picked up a burn, and that joker still had his clothes on. He had been burned by something. I think it was actually a lightning strike. He had been burned, and he didn't take his clothes off. When he got him to the hospital, his clothes were still smoldering a little bit. They were still smoking a little bit on the back of the ambulance. You got to stop the burning process. You are doing them, they might as well have a tree work on them if you're not going to stop the burning process. It continues to extend. then it gets into this severe fluid loss. You remember on the burn, when we talked about burns in advanced EMT, and I'm sure you probably talked about it a little bit when you talked about burns here, you've got those areas of those zones of a burn. You've got the zone of coagulation, what was it, the zone of necrosis coagulation, and anyways, the farther out it gets, the less severe it is, but it still has damage. It's the area of hyperemia, I think, is where the red around it is. Nonetheless, those burns can end up becoming real bad because of the damage that's done. Severe fluid loss. Y'all remember the Parkland formula? Where they were supposed to, depending on your size, you may get up to 10, 15 liters of fluid over 24 hours. If you've lost your barrier, if you've taken that container of, that Pyrex container of fluid that you had the top on last week, and you took the barrier off of it and dumped it all out, you've lost everything. And that's virtually the same thing. Whenever all of your skin gets burned off, you've lost your container. So it can't hold in sweat. It can't hold in fluids. You're going to be third spacing like a mug. It's not going to be in the cell. It's not going to be in the vascular space. It's going to be on that outside space. That outside space just happens to be in between the cell and the skin. So you're going to lose all that. And also, reduced circulation extends the depth. If they don't have good circulation, if they don't have that good oxygen coming, then it's going to make it worse. So obviously your management stopped the burning process. Your rules of 9 on an adult, I'm not going to call them all out to you here, but you can familiarize yourself. What's important to remember is that with a child, the old noggin is 18, right? Because they got that big old watermelon head, right? Their head is proportionally larger to their body than what an adult is. So it's going to naturally take up more body surface area. Then, if you look at their extremities, though, they're only 7 on the front and back of their legs. And then this is that London Browder chart. Just kind of giving you an idea. And the whole thought behind the Palmer rule is that you're using the patient's whole palm, fingertip to bottom. All right? That's going to be roughly 1% of their body. All right? You can't go up to a 2-year-old. I couldn't go up to my 2-year-old and use my palm. It's got to be her palm. All right? And that's usually the best way to figure out body surface area if it's a centralized or just a normal, not a normal, but just a. You get what I'm trying to say here. Stop the burning process. I think I skipped something. Get them away from the source. Obviously, you can't do them no good if they're still in the middle of the fire. Get away from the smoke. With fires and things like that, who do you think are going to be the most common patients for inhalation injuries and like carbon monoxide and cyanide poisoning? My man in the back there. And my man right there. Yeah, that's right. That's right. Yeah, because cyanide and CO2 are a byproduct of all this mess burning right here, and then there's no telling what they've got in their house. All right. You want to cool the skin, cool the clothing. Now, why don't you want to just continue? Why don't you want to just put a cold sheet, wet sheet over them, or continue to cool them off? They don't have any way to thermoregulate now, right? They don't have that barrier. Clean, dry sheets or blankets, sterile sheets are not necessary. I mean, your ambulance will have those sterile sheets usually wrapped up. Just don't want to use that. I mean, I don't know what, maybe they've changed. You do want to try to keep them warm to a degree, right? With your airway, what is an easy way to tell if somebody's got an airway burn?
He's blind.
The horse
Crap
voice.
around the voice.
Crap around their voice?
crap around their mouth, and then I was going with agreeance of what she said.
Yeah, yeah, yeah.
This is about to be
Halfway through,
limitation of
yeah.
time.
If they've got hoarseness around their mouth and crap around their voice, they probably got an inhalation burn, right?
Yeah. We're not gonna do
Yeah, this old soot, also sooty sputum. Singed nasal hair, eyebrows. Have y'all ever lit a grill that's had a little bit of time to fester that lighter fluid, or had a little bit of time to fester that propane gas up, and you're like, hey, I hope my grill lights. Yeah, I've never done that, but I've seen some people, and it's pretty funny that they kind of get their little eyebrows singed
Art.
and stuff. And then the hoarse voice, kind of like that lady on that smoking commercial.
Oh my God.
Yeah. Because of what we just talked about earlier, that the burns can extend, the burning process can extend. You want to continue with your frequent ongoing exams. And also, inhalation injuries can cause that laryngeal edema and that bronchoconstriction and all that, but it may take a little while for it to fester up, right? So you want to be sure you've always got your eye on them. I don't really know how falls have to do with burns unless you're falling from the atmosphere or something. I guess it's just saying.
Maybe if you're diving out the window. Of your
Yeah.
house.
Yeah, I guess so. Yeah, if your house is on fire and you fall out of your window, you gotta look at. Basically, what it's saying is that if you've got other, look for other mechanisms of injury too, because they must have been doing something stupid to get burned, right? I'm just kidding. With any burns, but especially with airway inhalation burns, you want to hit that high flow oxygen. All right, because if they've got inhalation burns, chances are they probably have breathed in just a little bit of that carbon monoxide or cyanide, right? So we want to try to get that displaced. Most people that die early on from burns don't die from the burn themselves. That's why your ABCs are so important. All right, they could be burned really, really bad. And yeah, they may end up getting septic or go into shock or something like that. But initially, if they've got a severe burn, their immediate issue is going to be airway. Most people that die from a burn related is because of airway compromise. Large bore IV access, if needed. Yeah, if they've got a pretty bad burn. If y'all remember going back to that Parkland formula, they're going to need a lot of fluid. And they're going to continue to need a lot of fluid. Because, number one, the body is lost its barrier, and number two, the body is in hyper overdrive metabolism. So it's going to get dehydrated very, very quickly. Pain management. If somebody's burned up, are we going to try to manage their pain? I say yes. Yes, says I. If they're burned up, we want to help them out just a little bit. Now, again, you've got to evaluate patient by patient. Are we going to benefit them by giving them just a little tease of 4 milligrams of morphine and knock down their respiratory drive and all that, or is it going to help them? All right, so you look at your risk over benefits, and I think the benefit of having that patient a little bit more manageable is going to be your best route. Injuries that benefit from a burn center. I'm not going to sit here and read all these, but they're in your book. Biggest thing is partial thickness burns greater than 10% of body surface area, or burns that involve anywhere with the airway, and also major joints too, and all those other things, but major joints because of the potential loss of function. Burn patients are going to have extensive rehab. They're going to have extensive rehab. So we need to go ahead, and again, you got to go with what your resources, what you have as far as resource-wise. if we need to get this patient stabilized, East Alabama is okay to go to, because long term, they're not going to keep a person that's got severe burns at East Alabama. They can't. They don't have a burn unit. So they're going to eventually get to where they need to go, but if you can at all cut out the middleman, go ahead and cut the middleman out. Does that make sense? Just know that with your burns, you don't always just have one burn. You could have different types of burns, and they're all from the same thing. Flash burns, circumferential burns, inhalation injuries. Never, ever, ever, ever forget about looking for inhalation injuries if somebody's burning. All right? They're burned bad enough to where you've been called. It's very possible they may have had an inhalation injury. Electrical burns. I'm surprised that they didn't throw the picture of the kid that bit through the electrical wire. Do you remember that one from the old textbooks, Greg? Where he had burns on the side here? Lightning injuries. They say lightning doesn't strike in the same place twice. Ask the person that's been struck twice and they'll tell you that's false. Radiation burns. Radiation burns, they're kind of a slow process, right? You don't die immediately from radiation. You die a slow, painful, cancerous death. Then your pediatric burns, that's going to just take on a whole different, a whole different level of alertness there. I mean, I'm going to take care of any adult, but then if I've got a kid, I'm kind of getting it a little bit more into overdrive. And with kids, it's especially important that they get to a burn center quickly, because kids compensate well for a little while, but what happens after that? They'll go back quickly. If they got these circumferential full thickness burns, they have to have that that word where they, yeah, that's it, where they cut down, they surgically lacerate that eschar, that leathery tissue, to give it room to expand. If it's a chest, you got to be sure that you are ready to bag them, because obviously you're not going to use a knife and cut their chest, but you need to be able to give them positive pressure ventilations. Flash burns. Usually it's from the explosion. Remember, you got your 4 stages of your blast. Your flash burn is usually going to be from that first wave, right? Depending on how bad it is, it could be full thickness. I was trying so hard to come up with a joke about a flash mob, but it didn't work. Then your associated symptoms, obviously, is going to be from different blast injuries, fractures from getting thrown around, internal injuries from the wave, from the blast. There's those inhalation injuries again. Take care of those. Also, you got to think about carbon monoxide poisoning, cyanide poisoning, anything that may displace the oxygen in an enclosed or oxygen-deprived environment. We know why you become hypoxic. A person with carbon monoxide poisoning may not ever look hypoxic at all, even though they are about to die from acidosis. Why is that?
Because the carbon monoxide binds with oxygen to
Right. The carbon monoxide binds with the hemoglobin, kind of fooling the body, thinking that it's getting something, but when it arrives there, they get disappointed in the package that was delivered because they can't use it. And eventually, from carbon monoxide, you're going to eventually go into cardiac hypoxia, but you're going to eventually just go into death, period, right? Because you're not getting oxygen to the cells. Carbon monoxide binds to hemoglobin in the form of carboxyhemoglobin. And then here's all your signs and symptoms. Management, obviously high flow oxygen. If you need to bag them, bag them. They will need to go to a hospital with a hyperbaric chamber because they're going to need to have that high pressure help force some of that CO out. Cyanide, cyanide doesn't necessarily, well, it doesn't. Cyanide and carbon monoxide have two different processes. Carbon monoxide, it alters the oxygen binding to the hemoglobin. Cyanide doesn't do anything with the hemoglobin, but it's kind of like a wall between the oxygen, the hemoglobin, and the cell. It doesn't allow the oxygen to get into the cell to be used. So, nonetheless, they're still going to become cellularly asphyxiated, and they're going to die. There is a cyanide kit for that, that's hydroxycobalamin. And I don't think, do ambulances have that? I know that we've got the Mark 1 kit. Do they have the cyanide antidote kit on there? I don't think so. You can get cyanide poisoning from eating a peach pit too, believe me. Your heat inhalation usually is going to just hit your upper airway. Usually don't see a lot of issue in the field, just because it takes a while for those processes to take into effect, and then once they start getting into the hospital, then they'll start getting the laryngeal edema and airway obstruction. Swollen lips, stridor. Stridor is a upper or lower airway sound? Upper airway sound. Nonetheless, whether they're showing it or not, if they're not breathing real good, I guess they would be showing it. But if they're not breathing good at all, you need to do what you need to do to try to get them taken care of. Now, it mentions RSI and all that. Y'all might want to learn RSI stuff, not just for registry, but for the state of Alabama. If you've got a patient that you suspect is going to have some inhalation injuries and stuff like that, let's go ahead and nip it in the bud and go ahead and paralyze them and get a tube stuffed down. Smoke inhalation, damage to your lower airways. You'll end up seeing a lot of issues with ARDS eventually. High flow oxygen. What's the inhaled beta agonist? Albuterol, right? Albuterol. We're getting there. Chemical burns. First thing for a chemical burn, if you arrive on scene and that chemical's still on their arm, what do? Get it off, right? What is a universal irritant? Water. Be sure that you get this contact off of them. If they've got a long sleeve shirt on and it's on their arms, it's in their clothes. Get them naked. Guess there could have been a more professional way to say that, but get their clothes off of them, right? Because if that chemical is on their clothes, what's it going to do to your ambulance? Contaminate it, right? Chemicals, not only can they burn superficially, but they can be absorbed into the body and get into the bloodstream. A lot of times you may just be dealing with the chemical burn itself, but systemically they could end up having some bad issues. Remove the source, flush copiously. Continue to flush and do your best to prevent secondary contamination. That's a chemical burn. If you notice, his skin's coming off. Also, you know, I'm sitting here trying to fathom what in the world, what chemicals did he put on his ears to burn them. I don't know. Electrical burns. Electrical issues is kind of a twofold issue, right? I've used that word a couple times today. If you got an electrical burn, you more than likely had electrical current pass through your body, right? What happens when you have electrical current pass through your body? Something's going to happen to the electrical systems in your body, right? Your heart and all that. So you need to be thinking that. Also, the type of burn and the amount of damage depends on AC, DC, and how much was actually shot. through them. I can't remember. I think DC is worse, right? AC is worse because it goes through and then comes back, right? Yeah. What does the body do for electricity? It provides it a what? A way to get to a ground, right? Electricity wants to get to a ground. So it's going to pass through a lot of areas in the body. Your cardiac issues. Look for your entrance and exit wounds. If that current went through one spot, it's probably going to come out of another. Also, the heat is great. It's a lot of heat. And so it could actually cause other thermal type burns too. Then of course, be sure you look at the big picture and look at all the other types of stuff. Rhabdomyolysis. Rhabdo is the breakdown of muscle, right? Can occur in compartment syndrome. Also when you have kidney issues as well. Rhabdo is going to really affect the kidneys. They're going to need some fluid because they need to get that urine output back up, because if the kidneys don't work, then they're going to go into kidney failure. Again, the treatment's about the same with all these burns. You know, you're going to systemically manage or locally manage it, but then systemically you're going to hook them up with fluids, large bore IVs, and all that good stuff. All right? A couple other good pictures. Your lightning burns, extreme voltage, a lot of voltage. You could have direct contact, or the lightning could have hit the tree that you're standing next to, and you could have incurred some of the wrath of the lightning gods by standing next to their tree. I mean, it really depends on, you know, was it a direct contact, was it an indirect contact? Nonetheless, if you're anywhere around where lightning strikes, you're going to get hurt one way or another. Lightning strikes kind of cool the way that they kind of present with like the little branching out and all that stuff. Probably not cool to the person that got struck. Radiation burns, get them away from the source. Usually they don't develop though normally, or they don't develop instantly like a thermal burn would. You're in danger of a fluid shift with this too. What is a fluid shift? Third spacing. It's not in the cells, it's not in the vascular space, it's just in a space that we can't use it. Manage your ongoing assessment. If it's a long transport, you know, manage your urinary output if they've got to pee. You want to get fluid administration. I mentioned the Parkland formula. This is going to be a collaboration of professionals taking care of this patient. All right, you would initiate it. Essentially, the idea is good that you would initiate it, and then they would carry it out for the next 24 hours. All right, it's 4 cc's per kilogram times the BSA times their body weight. And if you're in my advanced class, you saw that a lot. With pediatric burns, obviously they're not developed as much as an adult. They don't have that old thick leathery skin. They've also got a larger body surface area associated or relative to their body. You know, they got that big old watermelon head that's worth 18% instead of 9%, right? So they've got a better chance of having a lot more relative to their size burned up. A lot bigger body surface area. A lot of times it's accidental. The kid pulls the boiling water on their head or the grease or something like that, or they're just around something they don't need to be around. But unfortunately, the cold hard truth is a lot of times it's going to be child neglect and abuse. And you know how to look for those, the stocking burns, cigarette burns, lighter burns. It's not good. So anyways, your safety is essential. You want to make sure that you're safe. You're not going to get burned up. Your partner's not going to get burned up, and that you stop the burning process. That's the most important part of managing a burn, is to stop the burning process. Any questions?